Hello everyone. Let me start with a small story. Imagine this. You are a medical student, first year, surrounded by biochemistry pathways, physiology graphs, and anatomy diagrams. You ask yourself, when will this actually help a real patient? Fast forward a few years. You are in a ward. A patient asks, Doctor, why am I taking this medicine? And suddenly, that's why pharmacology walks in. Pharmacology is not just about drugs. It is the translator between the laboratory and the bedside. Basic sciences tell us what exists. Clinical medicine tells us what to do. Pharmacology answers the most important question. How do we use science to help this patient right now? Think of pharmacology like a bridge over a river. On one side, molecules, receptors, enzymes, half-lives. On the other side, prescriptions, doses, benefits, side effects. Without that bridge, science stays in textbooks and treatment becomes guesswork. Here's a simple life example. Knowing physiology tells you blood pressure exists. Knowing pathology tells you how hypertension causes harm. But pharmacology teaches you which drug to choose, why this dose, why not that patient, and what could go wrong. That's not theory, that's clinical thinking. There's a famous saying, a good doctor knows what to prescribe. A great doctor knows why. That why lives in pharmacology. Pharmacology trains your mind to balance benefit versus risk, dose versus toxicity, evidence versus empathy. So, when we say pharmacology is a bridge, we don't mean a boring academic link. We mean a living connection between science and care, between knowledge and responsibility, between the exam hall and the patient's bedside. And that's why we say learn pharmacology for patients, not just for exams. Thank you for listening. Stay curious, stay ethical, stay clinically relevant. See you next time on Pharmacology Tricks of the Trade. Disclaimer. This content is intended for educational purposes only, reflects original commentary, does not reproduce copyrighted material, is not sponsored, and does not replace professional medical judgment. Bye.